Welcome to Robert Wood Johnson University Hospital, Somerset's Health Talk. I am Dr. Douglas Oshinsky of RWJBarnabas Health Medical Group. The lazy, hazy days of summer are back, and so are an array of health and safety challenges posed by sunshine, hot temperatures, and seasonal outdoor activities. Emergency room department visits increase up to 27% in warmer months nationwide due to accidents, heat stroke, insect bites, and other summer mishaps. During today's show, we'll learn more about how to stay safe this summer and when to seek medical care from our special guest, Dr. Michael Marchetti. Dr. Marchetti is an emergency medicine physician with RWJBarnabas Health Medical Group and Robert Wood Johnson University Hospital Somerset's Urgent Care Center in Hillsborough. In accordance with social distancing due to the COVID-19 pandemic, Dr. Marchetti will be joining us remotely via video conferencing. Welcome to our show, Dr. Marchetti. It's a pleasure to have you here. Now, for our audience, can you tell us a little bit about your background and what got you interested in both the emergency room as well as the RWJBH Hillsborough Urgent Care Center?
Sure. Well, I went all the way back. I guess my mom's a nurse, my dad's a doctor, so I've always been interested in medicine. As I went through the process, I found emergency medicine very attractive because it's real patient care. I get to make a huge difference in people's lives in a short amount of time. It's very exciting. I do the diagnostic challenge workup all day, talk to people, examine them, try to figure out what's wrong and fix them. I'm usually very successful at that. We can't do complete care because it's emergency care. So sometimes we solve your problem completely. Sometimes we refer you on to other physicians that follow up, like an orthopedic if you broke a bone. I've been an emergency physician for 30 years now. I worked at Bayshore Community Hospital in Homedale for the first 25 years. After 25 years, I was approached to run the urgent care out here by my boss, Dr. Milano, and partially because of my patient care skills, partially because of my patient satisfaction skills. I guess I talk good and people understand me, and so people appreciate that, and that's something I specialize in is taking good care of patients, making sure they understand what's going on, communicating effectively. And so I've been here now for 5 years. I'm enjoying the transition. A little less stressed in the emergency room while still providing good patient care and doing what I love, being a doctor, walking in, figuring out what's wrong and fixing people. So, but a little easier on my brain. And as I get older, a little easier on my brain is a good thing.
I actually think you may actually have it harder in the urgent care center than the ER because you don't have the backup that they do in the ER. And I think it's magnificent the work that's done over at RWJBarnabas Health Urgent Care Center in Hillsborough because people walk in and you have absolutely no idea what they're coming in, and you're able to put them all together and fix them acutely, and most people do such great care with.
Well, thank you. Yeah, we have only board-certified emergency physicians here. All our doctors have been ER physicians for at least 20 years. So we're used to taking care of whatever comes in. As an emergency physician, you have backup, but often not for hours. So if we need more urgent backup, we send them to the emergency room. If you come in with chest pain, have an abnormal EKG, or bad abdominal pain, need a CAT scan, then I can still refer them out for the care they need in the emergency center if I think that I can handle it and then just completely treat them, or see them and then have their primary care physician follow up in a day or two because it's a less acute problem and just kind of tide them over, then we do that. So we're used to taking care of whatever walks in the door for the first few hours and then deciding how urgent the follow-up care is necessary, whether home with the doctor or to call a specialist in the ER, or in this case, to send them to the ER if they need that kind of backup care. We have a great relationship with Robert Wood Johnson facilities like New Brunswick and Somerset. If you need emergency care, we call the emergency room to discuss what care we think is needed, what's going on. So there's good communication. They write notes in their computer, so whoever picks up the patient when they get there can follow up. So we have the follow-up care. It's just not in the same building, so to speak, but we can get it anytime we need because Robert Wood Johnson provides a full spectrum of healthcare. So I can get them either to a specialist at the office that's associated with the system or into the ER as needed.
And what's even nicer is now that we're in the midst of the Epic upgrade and we'll all be on the same EMR system, what you do in your office will easily be able to be put into the computer and they'll be able to see what you've done so that the continuation of care and not doing unnecessary or repeating the same tests will be able to be done through the Robert Wood Johnson RWJBarnabas Health System.
Exactly. It's wonderful. I can see them here. The primary care can then see them in the office, pick up where I left off by reading my notes or contacting me. The ER the same way. All three of us, the primary, the ER, us, everybody throughout the spectrum of care can coordinate. That's the whole idea of having a system-wide system like Epic for charting and progress notes.
Okay, so now it's summertime in the city. So there are a lot of safety precautions that I'm sure you want to mention, things that we need to think about during the summer. The number one thing, of course, is the sun is out for a much longer period of time and it gets hot.
Yep.
So what should we do? What should people think about with the heat and heat exhaustion and playing and sports and exercise?
Okay, so the two primary things related to the sun are, as you mentioned, heat exhaustion, heat stroke being even more serious. The key is to manage yourself, to use common sense, to look for the warning signs. If you're feeling a little off, a little fatigued, a little out of it, you probably need to drink more fluids. Hydration is key for preventing heat exhaustion and heat stroke. That's the main thing. The body's thermoregulatory system is awesome and can really get you through anything but the most extreme conditions, but you have to pay attention. You have to manage your sun exposure and your heat exposure. Get in the shade, an umbrella, wherever you need to go to minimize your heat gain, and keep yourself hydrated so the body's system can effectively cool you down. If you're not well hydrated, the perspiration and evaporation system that we use to cool ourselves can't work effectively. So hydration is key to preventing heat stroke and heat exhaustion.
So again, prevention is so important. What
Absolutely.
the people need to understand is that if it's going to be hot, they have to increase the amount of fluids they're going to consume prior to going out. Normally, we say 6 to 10 glasses of fluid a day. If it's going to be 80, 90 degrees and you're going to be outside, you may want to increase that prior to going outside.
Absolutely. And then follow your body's clues as far as if you're feeling weak and sluggish, monitor your urine output. If you're not getting up to pee every 2 to 3 hours, you're not hydrated well enough. If your urine's dark when you do pee, then you're not hydrated well enough. And those are the main clues there. If you're really feeling sick, and you don't feel like you're doing well, you can always come to the urgent care. We can evaluate you by looking at things like dry mucous membranes, checking your pulse and blood pressure, running a urinalysis if we want to see if it's concentrated, and encouraging, hopefully, just that you need to drink more fluids. If we think there's something more serious going on, then we could again refer you to the emergency department for blood work, IV hydration. If there's concerns for something worse than plain heat exhaustion, like heat stroke, you may have a fever with heat stroke and have neurologic symptoms actually. So treating those things more urgent, that becomes a more urgent case where the emergency room would be more appropriate. But most of the time we can evaluate and get you back on your feet again.
And again, the other things to remember is if you're going to do exercise, to do it early in the morning or late at night, to try to avoid doing it in the middle of the day when the sun's out and it's highest. And then again, if you notice that you're outside exercising and there's no perspiration, then that's a clue that you need to get into a cool area, get fluids in, and possibly consider a visit to the urgent care center at Hillsborough, because it may be the early warning signs of heat exhaustion.
Absolutely correct, yes.
The other thing is, since they're out in the sun, is the exposure to sun, the importance of sunblocks, hats, sunglasses.
Sure, I agree with all that. People have heard that a lot. There's one thing I've talked to people over the years that I've wanted to get the message out better on, that people don't understand. I mean, Sun tanning is something people like to do. You're not going to convince them to completely avoid it like they should. So teaching them how to do it properly, I think, is important. What most people don't know is it only takes 8 to 10 minutes maximum of sun exposure to turn on your melanin cells. And so for people who want the deep dark tan with minimal damage to their system, if they go out at 10 o'clock, hopefully with a little sunscreen on, but some people just want to get dark, you tell them just do 8 minutes, then leave the sun, slather on the number 50. If you really want to keep it going at 4 p.m., go get another 8 minutes of sun. And now you'll be tanning from 10 in the morning till 2 in the morning with only 20 minutes total exposure. And I think if people understood that, they would not bake so much. They would say, fine, I've got my 10 minutes. My melanin cells are cooking. Let me slather on the 50, get under the umbrella, and not worry about, any more sun. You're just going to get burn color after that, and that's the damaging part.
At the same time, since they're going down to the shore and the beach, they're not going to only spend 8 to 10 minutes at 10 o'clock. What they're going to do is they're going to be there the whole day. So it's 8 to 10 minutes and then get underneath the umbrella, etc., so that they do not burn.
Right, and put on the number 30 or 50 or whatever you got, slather it on, keep repeating it because you're not going to get any more color for the next 6 hours. People are like, oh, well, I'll leave it off for a while, get a little more sun. And that's just not beneficial. It doesn't help you tan, and all it does is help you burn more. And that's damaging, leading to cancers and everything else.
And of course, the other thing is the hats, the sunglasses, and also when they do put the sunblock on, making sure they put it on their neck, because a lot of people miss their neck. A lot of people miss their cheeks, their ears, and those of us who are a little bit older who have no hair on the top of our heads, we need to make sure that we do our scalp. And now that they've got the spray-on sunblock, even on the hair, on the scalp itself, so that the little bits up here don't get burnt and they don't start to have problems.
Right there with you. At this point, I'm 58 now. I got plenty of spots the sun gets through. I use the spray. I use a hat. I live at the beach, and so I'm out there all the time. So I try to ascribe to my knowledge of, just getting my 8 to 10 minutes and making sure I'm covered up the entire rest of the day. I don't need a deep dark tan. Some people want it, and if they understand the principles behind it, hopefully that'll lessen their exposure. And
so making sunblock part of their morning rituals is probably a good idea also, after they've brushed their teeth.
The recommendation is every morning when you get up, even in the middle of winter, you put on sunscreen because you're getting that color all year round. And, you need to put it on at least 20, 30 minutes before going in the sun for it to be effective. So absolutely, getting up and putting it on your face in exposed areas every morning. Especially in the summer when you think you're going to be in and out of the sun. A lot of people don't do it because, I'm just going to be 10 minutes running back and forth to the store, hanging out over here. So you're correct. Yeah. Just doing this in the morning before you head out for your day, every day in the summer at least, and hopefully year round would be what the dermatologist would like you to do. Just the most they can do, the better they do it, the better they do it.
Summertime also, people are going to be exploring. They're going to be hiking. They're going to be walking, running. Can you tell us a little bit about what blisters are and things that we can do to prevent them?
Sure. So, blisters are a body's reaction. The tissues get overused and inflamed. You'll start to have a painful sore spot. It'll feel hot and warm. And that's the time you want to intervene. Once you have any kind of discomfort in your feet, you don't want to wait it out until you get a full blister. Then you're dealing with open wounds and pain for days or weeks, trying to walk on an open wound. So again, prevention is key. Changing your socks. I'm an Eagle Scout and a Scoutmaster at this point, so we do a lot of hiking. We always bring spare socks, and after, at lunch, we change out into the dry socks, put the moist ones back on the back. Wet feet are going to get blistered up a lot quicker than dry feet. We carry something called moleskin, and even duct tape works very good. If you feel a warm spot, you just put a little piece of the moleskin or duct tape on there, and now the rubbing occurs between your shoe and the duct tape, not your shoe and the skin. So creating a physical barrier, as soon as you feel a little warm spot anywhere, drying your feet off, taking them out of your shoes and opening everything up for a little bit is key. Once you get the blister, you're going to want to leave it intact. keep it covered once it opens on its own, or if it's a really big blister and we need to debride it for some reason, which we offer at the urgent care. Once it's open, now you got to keep antibiotic ointments on there, keep it covered with a bandage. The moleskin is only good when the skin's still intact. Since it's got a sticky substance on it, just like duct tape, then you wouldn't want to put that on an open blister.
So important things for the summertime, again, is one, dry socks. And even consideration of putting some type of powder inside the sock so that your feet do stay dry. Also reduces,
Absolutely.
of course, the risk of developing any fungal infections on the toes also. If you're going to go for long periods of time, bringing in an extra set of socks, because in case they do get wet, getting them off, drying the feet, putting a little bit more powder on and getting them into the clean, dry sock is important.
Absolutely, yeah.
And then the other thing that's very important for people to realize is how important the shoe that they're wearing is. How it has to be comfortable, it has to fit correctly, and also having some type of an arch support to help prevent any problems from a plantar fasciitis.
Absolutely, yes. Knowing the proper gear for any outing is essential. Good hiking boots if you're taking a long hike, something that's broken in well. You don't want to wear brand new boots on a hike that you haven't broken in, because that's going to cause some rubbing. It can be as simple as, well-fitting sneakers if you don't have things. But again, well-fitting, something you're comfortable with is important. If you do think you're going to be hiking where it may get wet, you'll have to cross streams or anything, most experienced hikers will have a spare pair of shoes in their bag that they wear around camp in the evening to let their boots dry out. Or if they have to cross that stream, they'll put on the other shoes, get wet in those, and then put their sturdier, better hiking shoes back on when they get across the stream.
And then, of course, while they're out there, making sure after they've done the hike, looking on their legs and any exposed area for ticks.
Absolutely. Ticks are a huge problem in the area we live. Lyme's disease, as well as many other tick-borne illnesses. You can get local infections. You can get a typical Lyme's disease. Knowing that, removal is important. They like to crawl into dark spots. So you have to check everywhere after a hike, under your armpits. We go camping. We bring a mirror to check around the private area and the buttocks and stuff. Other people can help each other out by checking their hair where you might not see it. It's impossible to check your own scalp. So having your hiking partner at the end of the day, just look at areas you can't look at, like your scalp and hair. Or when you get home, if not your hiking partner, then your significant other, whoever else you have home.
And of course, looking at the children who you're hiking with you also, because it's with them also having exposed legs, looking all over them also.
Absolutely. And as you mentioned, exposed legs, it's tough when the summertime really hits to get people to wear long pants, long shirts. Many people will wear, light colored clothing, white or tan, tuck it into their socks, wear longer tops, just because the ticks show up so well. It takes a little while to get through that barrier into your deep, dark places. And so you can spot them while they're crawling around on white or tan stuff, because most ticks, of course, are dark.
And then, of course, poison ivy and poison oak and poison sumac.
Absolutely a problem. We see a lot of at the urgent care. When it gets really bad, we can evaluate people for anti-inflammatories, different steroid creams, as well as even oral prednisone if it gets really bad with facial swelling and big oozing wounds. It's a little secret weapon we have that works good. And again, prevention is the key. Knowing what you're looking at. If you're going to be outside, you want to know what poison ivy looks like in all its forms. You want to know what poison sumac and poison oak look like and avoid them. If you think you suddenly touch them, washing immediately within 30 minutes or less is important to remove the oil. Once the oil seeps in, you're stuck with it now.
And, of course, cleaning, and immediately when you finish the hike, going in the house, taking your clothes off and putting them into the laundry. So in case there's any oils on your clothes, you don't inadvertently pick that up also.
Correct. The clothes are important, and most people put their clothes in the washer. The things people miss a lot of times are things you don't typically wash. So your boots have been walking through the ivy. Now there's oil on your boots. Next time you go to tie your laces, you now have oil on your hands again. Hot day out here, and suddenly 2 weeks after the hike, you got poison on your face. You can't remember why. So hats, sunglasses, belts, hiking poles. If you're in the garden, you got to think about your rakes, your hose, your wheelbarrow. Anything you touched and now grabbed now has oil on it. And if you don't wash those down with hot soapy water, then you're going to get re-exposed and have no idea where you got it from 2 weeks later. If you took a hike and got in your car, you grabbed your steering wheel. If it's on your legs and you sat against the seat now has oil. It gets tough. You got to, if you know where you got it and when you got it, then you can kind of go through what you had on. The problem is people don't see it until a couple days later when it comes out, and they don't really know where they got it. Lots of people do. They say, I was working in the garden 3 days ago. I know I grabbed some questionable stuff. I thought I was being careful, but I wasn't. And I'm like, okay, go home, think about what rakes you used, what hedge trimmers you had, and wash everything off.
And then, of course, wearing gloves is helpful also, because as soon as you finish the hike, those gloves can be taken off inside out, thrown immediately into the laundry, and you won't have to worry about going like this afterwards.
Correct. Yep. Anything that you usually don't wash that you might have touched something with, you need to wash.
Okay, so we finished with the hiking, and now we go out and play some softball, baseball, and now we have, because it's summertime and we're doing things a lot more than we did because we just got out of a pandemic, we hurt ourselves. So what are the common sports injuries that you're seeing, are the ones that you expect during the summer, and tips that you would have for people to prevent them from happening?
Well, obviously, from a prevention point of view, doing a good warm-up, wearing proper safety equipment is key to most sprains, strains, and fractures. If you're rollerblading or skateboarding or things like that, wrist guards are the best thing you can use. People constantly, from both winter and summer, winter snowboarding, summer skateboards and rollerblades and other things, they break their wrists. So wearing wrist guards and proper safety equipment is very important. For ankles, just loosening up, making sure you're in good shape for whatever activity you're going to do is important. The weekend warriors get hurt more than the people who do it every day because your muscles and ligaments are tuned up and ready to go. If you're doing this regularly, like kids in their baseball and they're doing it all the time, their body's ready for it. The others of us who don't do these kinds of sports every day and then go out and do them need to really assess their ability level. Do some good stretches of your feet, ankles, and, pay attention to what you're doing. When you're hiking, make sure you're paying attention to the ground and loose rocks, uneven surfaces. So you're not. We see a ton of twisted ankles. We see a lot of sprained fingers from ball playing, where a ball hits you, whether a baseball, a basketball. Finger injuries are a big problem. They're tough to prevent. Once you have injured them, taping them up for a couple of weeks to a month afterwards is important. We've all heard the RICE acronym with rest, ice, compress, and elevate. Dr. Mike says PRICE because you have to prevent re-injury, whether it's your ankles, your fingers, you're taping them up for a little while longer. We give them an ankle brace. If they come in, we do an x-ray. It's not broken. We give them an ankle brace. It's a big, clumsy thing that works fantastically, but people get rid of it too soon. They go out and they're like, I'm not wearing this thing again. So instead of just stopping with the brace we gave them, going on and buying a smaller brace, wrapping with just an ace bandage, something, a little slip-on, neoprene brace, and downgrading slowly because it takes months with good physical therapy before your muscles and ligaments fully heal. They take a long time, and you'll just be walking down the street thinking you're all better, hit a loose rock, and boink, back to square one. So prevention up front, safety equipment, proper knowledge of what you can and can't do, and assessing your limitations and preparing for the sports is all very important.
I like that Dr. Mike acronym of PRICE.
The PRICE, protect and prevent re-injury. Protect yourself and prevent re-injury. I think that's mine. I don't know.
Well, I said I'm going to give you credit for it.
All right, good.
Okay, so the important things for people to do. One is they've got to basically watch what athletes do. Prior to an athlete starting a game, especially nowadays when we're watching baseball, you see the athletes in the outfield with the therapists doing lots of stretching exercises. Yep. You then see them doing these funny running motions, bringing their knees up as high as possible to stretch those ligaments out. You then watch them go side to side with their upper body and doing twisting motion almost like a helicopter to do the stretching also. They'll usually then stand, and a physical therapist will pull at their arm and leg in order to stretch those out also. The person then plays the sport, and then when you watch them in the interview, they've got the ice on their shoulder, their knee, or something afterwards. Yep. So it's important, even though we may be weekend athletes, to be doing the similar type of things, maybe not to the extent that they do, or maybe actually even more extent because we're not used to what they do. And then we try to do things like that, and then during the sport itself, try not to overdo what you know you can't do.
Absolutely all correct. Yep, we probably need to do more than them because they're doing it every day, so their bodies are used to it. Our bodies are very often not used to it. Again, the weekend warrior who goes out for softball once every 3 weeks, or goes to play basketball with his buddies on a day when he hasn't done it in 3 weeks, the body's ligaments, muscles, tendons are just not ready for it. So you have to go a little slower, evaluate your possibilities, do the warm-ups, a good, thorough, think of everything your body's going to do, and do it slowly before you start doing it quickly.
And then afterwards, allow your body to rest before you do another sport.
Correct. Cool down period is important. Give your body a chance to recuperate. Some static stretching then afterwards to stretch out your muscles that are tight from the activity. These are all important aspects of keeping yourself healthy and not ending up coming to see me at the urgent care.
And then possibly after the day of rest, going back and doing calisthenics, weight-bearing exercises, aerobic exercises to improve yourself so that the next time you go out, you hopefully have less risk of developing a problem.
Absolutely. Use every opportunity to start making those lifetime changes to get yourself in shape, keep yourself in shape for all the right reasons.
And then if all else fails and something happens, remember the fact that we do have the RWJBH Hillsborough Urgent Care Center, which is open every day.
Every day, 365 days a year. We're open 8 to 8 on weekdays and 9 to 4 on weekends and holidays. We do have in-house x-ray. We read the films immediately and can send them for a radiologist to reread them just to double check if needed. We have an orthopedic right next door who sees people within 24 to 48 hours. So we have excellent sprain, strain, and fracture care here. It's not like call the orthopedic and third Tuesday in July, they'll get around to you. Dr. Tovey is very good to us. He's housed in the same building. He can look at our x-rays. You don't have to go anywhere else. And we can almost always get you an appointment within 24 to 48 hours, weekends excluded. So we're really well versed at sprain, strain, and fracture care because everything's in-house. And we have the immediate backup. If people do have their own orthopedic, we're happy to copy the x-rays for them and let them follow up with their primary care. We have all those facilities in-house. And again, being emergency trained physicians, we're all very good at splinting, reducing minor fractures and dislocations and things like that.
And with a terrific front desk office that can triage people to the right way.
Absolutely. Yep. They get you in quickly. We get you evaluated, get you out either home with definitive care to the orthopedic or, God forbid, to the emergency room if something's really bad.
So as we conclude today, what are the key messages you want to leave the audience about how to have a good, safe, and healthy summer?
Start your exercising now. Get into a routine. It's a good time of year. Everybody's happy to go out. Start light. Just start walking. Then start slowly adding little things in there. When I start my workouts for the year, I start very light, very low weights, very minimal. And then every time I work out, I throw an extra little thing in there until I get up to where I need to be. I emphasize a good warm-up, and then I'm prepared for whatever I decide to do. I do a lot of things, kite surfing, windsurfing, that jerk my body in various directions, so I make sure I maintain myself. And the other keys I think you got to worry about, we went over, as far as the sun. I think minimizing your sun exposure. I see a lot of sunburns, people blistered up on their shoulders and arms and just very miserable. So I think if we could keep the sports injuries down, the sun under control, certainly, as you mentioned, the poison ivy, ticks, these are all big summertime issues we see. You don't want to become friendly with your urgent care physician. So prevention, prevention, prevention.
This concludes today's episode of Robert Wood Johnson University Hospital Somerset's Health Talk. Please remember that the opinions expressed here by our medical experts are not a substitute for medical advice from your own physician. If you need a physician, please call our physician referral line at 888-724-7123. For more information about Robert Wood Johnson University Hospital, Somerset, please visit us at www.rwjbh.org/Somerset.